In 2012, 350 million people are affected by depression. But what actually causes depression? Many experts feel that it is caused by a chemical imbalance in the brain. As such, antidepressants such as Prozac are the first line of treatment for depression. There are many classes of antidepressants, but the most commonly prescribed class is the Selective Serotonin Reuptake Inhibitors, and therefore will be the main focus. Common examples of SSRIs include Prozac and Paxil. SSRIs are thought to inhibit the reuptake of serotonin, a neurotransmitter found in the central nervous system. This increases the level of serotonin in the brain and makes patients less depressed. Yay! But is that really the case? There is a huge debate over the efficacy of SSRIs, and the reasons are as follows. Firstly, published studies showed that SSRIs are significantly better than placebos. However,
researchers actually analyzed all of this data. They found that these medications were no better than a dummy pill or a placebo.
An analysis of the studies was done and concluded that the mean difference in the drug placebo effect was only 1.8 on the Hamilton scale. A difference of 1.8 was statistically significant, but not clinically significant. Statistical significance means that the results obtained did not occur by chance. Unlike statistical significance, clinical significance takes into consideration the importance of the difference in drug effects. According to the guidelines set by National Institute for Health and Clinical Excellence, the drug-placebo difference has to be at least 3 points in order for it to be of clinical significance. Secondly, there are more published studies showing positive results as compared to published studies showing negative results. Yet, it must be noted that SSRIs seemed effective due to publication bias, where both the pharmaceutical companies and regulatory agencies such as FDA were more inclined to publish the positive studies than the negative studies. In Sweden, 90% of the positive studies were published, while only 25% of the negative studies were published. Thirdly, by looking at the clinical studies that were published, it can be concluded that SSRIs are effective. This is because the trials conducted were double-blinded, and hence the results obtained would be unbiased. However, it is argued that the therapeutic effects of SSRIs are overstated because the subjects participating in these clinical trials can break blind. This is because prior to the commencement of the clinical trials, the subjects would have been informed that the drug produces side effects, and they would be told what those side effects are. Subjects can therefore guess the treatment they are administered. As such, subjects given the active drug may exhibit an amplified placebo response. In one of the studies conducted, 80% of the subjects correctly identified if they were given the drug or placebo. Finally, SSRIs are effective because there is a lack of serotonin in the brain, and SSRIs work by increasing the level of serotonin, hence alleviating depression. However, there is still no concrete evidence to prove the chemical imbalance theory of depression, which makes the prescription of antidepressants unjustified. In conclusion, SSRIs are ineffective in suppressing depression because its therapeutic effects are comparable to placebo pills. The efficacy of SSRIs is also overstated due to publication bias and flaws in the methodology of the clinical trials. Lastly, there is no concrete evidence to show that depression is caused by a chemical imbalance in the brain.